Three, two. Hey, Talon. So talk to us. Tell me one or a couple of tactics, strategies, or thoughts we can do with mailers that you know can definitely help other practice owners out if we were to implement it today.
Yeah, so a couple of things that we like to do. One is make sure your mailer has a really strong draw, something to get the patients in the chair.
Mhm.
We look at our mailers as kind of like broad marketing just to get our name out there and then get people in the office, and then we're going to win them over. So whether that's low cost exams, discounts on services, or advertising whatever services you do, that helps quite a bit.
Gotcha. Okay, so when it comes to the strong draw, give me like an example of how you or what do you have on your mailers or postcards?
Yeah, so we've got a simple thing that's like a new patient special, for instance. 199 or something like that. And so 199 is not cheap, right? You can probably
Mhm.
find five other offices within five do it for 99 or $0 or
Mhm.
something like that. But just having the new patient special on there helps. And we actually don't advertise the price on the mailer. We actually just say that we have a special, and then people call about that special. And by the time we get them on the phone, we can win them over at that point.
Nice. So that's like, do you normally, because I've always heard like, hey, you should only do them like seasonal, depending on the special. So like maybe winter through spring, it's going to be new patient special. Then summer, it's going to be about Invisalign. Or do you do that or no? You just order like a bulk amount?
Well, we take uh, a shotgun approach with our mailers. So we send out 27 to 30,000 mailers per month. And so I'm not really spending a lot of time trying to calibrate each individual campaign necessarily. And so we kind of have our set things that have worked for us. And then we just send those out every single month.
Gotcha. And that's the shotgun approach. So then when it comes to low cost exams, that's the price that you promote one or not promote, but like talk about 199.
Yeah, so for low cost exams, like we do a free exam for any single tooth. And it's very clear that it's a single tooth. So if a patient says, I've got a bunch of problems, but they want to come in for that free exam, we say, you have two options. You can either go with our new patient special, or you can just get one tooth looked at. And it's important to be really strict with that, because if the patient comes in, so, well, thought I got a free exam. It's like, well, no, we were really clear with you. It's one tooth. And so that helps to kind of weed out the kind of price shoppery type people and things like that. Because in the past we've had free exams and stuff like that, and it's really really ineffective and gotten a lot of really bad patients out of it. So
Mhm.
by really being really intentional on the front end with our phone skills and things like that, it's helped kind of weed out the uh, problem patients.
Yeah, I like that. Now we're getting to like the meat and potatoes here. So you say
Yeah,
like, hey, single tooth only on
yeah,
the phone. And
yeah.
then
One tooth, one X-ray, one tooth.
gotcha. Okay. And then so from that point on, it's up to them if they decide like, oh, I thought it was the whole thing. And then they're like, well, who does the single tooth? And then do you get a lot of upset people or no, they understand?
No, like again, if we're very clear up front, nobody who comes into my office doesn't know that it's for a single tooth. And so if we say, hey, taking a look here, I see you've got three or four other things
Mhm.
going on. If you want us to really get you a better comprehensive look, here's how much that costs. And, we can certainly get that done for you today. And so we have pretty good conversion on that because, a lot of people want to get something done or get something looked at. And if it's possible that their problem is related to more than one tooth, they don't want to leave without getting, no information or no treatment plan. So
How many would you say new patients in a month come from like your mailers or the shotgun approach?
yeah, so we've historically we used to only send out 20,000, and so I would say we got 20 to 25 per month from that 20,000. Since we moved my practice and increased our capacity a lot, our new patient numbers have gone up probably 30 to 40%. Um, it's hard to say exactly how many of those I can 100% attribute to mailers, because a lot of the times, a patient will see a mailer and then they'll go check your website, check your Google reviews. And you ask them, well, how'd you hear about us? And they say, Google or something like
Mm.
that, when actually they've seen your mailer. Um, but I would certainly say we're getting at least probably 25 to 30 a month, from the mailers, which in my practice, the average new patient is worth between 1,000 to 2,500. And so I think we average around 1,700 for a new patient. So that's a really, really good ROI. for how much I'm paying for the mailers.
Yeah, that is good. Was it always like that, or have you always done this approach, or have you like kind of nitpicked it and refined it?
Yeah, so we started doing mailers when I bought this practice 2.5 years ago, and we sent out very few, and we had that kind of really detailed. I think the sniper approach. I like that.
Mhm.
That's what I call it: sniper versus shotgun. And we had the really detailed call tracking and all that sort of thing. And in hindsight, the mailer itself was actually very similar to what we send out now,
Mhm.
and we gotten just nowhere near the success that we have now. And so it's one of those things where it might just be like market dependent, where you just have to kind of figure out what actually works in your market. And for us, it was just sending out 2 to 3 times as many mailers as we used to, and then being really intentional about how we handle the patients that respond to them.
Do you plan to eventually stop or no?
The only time we would stop is when we truly are at capacity. And so, when you don't want new patients anymore, which for a growing practice, it could be 2 to 3 years before we're completely at capacity, have split shifted schedules, hired as many dentists as we can, open 6 days a week, all those sorts of things.
Mhm.
Getting to capacity is something that takes a long time to do.
Gotcha. So, how many drops do you normally do with these mailers in a year?
12. So we do once a month, 27,000 to 30,000 each time.
Wow. So then the total budget for that in a year would be how much?
So I'm currently paying, I think it's 5,500 for my under 30,000 a month. So it's, I guess, 70, 80,000 a year that I'm spending
Okay.
um, on mailers.
And that's all you're doing, like EDDM, or are you paying a company?
So I use Clipper is the company I work with, but there's a bunch of companies like Ad Pages or Valpak as well that offer very similar rates. I think it comes out to between 18 cents and 20 cents per mailer, which with EDDM, I don't think you can really get below like 25, 26 cents. So the companies that offer it for cheaper than EDDM are ones that have like local magazine distribution that they
Mhm.
piggyback off of. And so that's how they're able to get it below EDDM prices, basically. So you get all the benefits of the low price without me having to like sort mailers and take 15,000 at a time, or 5,000 at a time, I guess is the limit to a mail post office and things like that.
Yeah. Man, that's interesting. I like your approach though, because like it's not so dependent on the postcard, right? Where you're like, well, it didn't convert because of the postcard, or the mailer. It's more like as long as they call, right? And
Yeah.
then you guys can handle it from that point on, which is I think is really, really good.
Yeah.
Um, so with that being said, with everything like the mailers and what you're doing and how much you're paying, what's one of the last pieces of advice you want to give when people who are like thinking about doing it? Maybe they're like, I've done it already. It sucks. I never worked. What's like your advice on that?
Yeah. So I would just say that I've been there, and we did mailers in the past, and it did suck. It was terrible. It was the worst investment in marketing I've ever made in my practice. But we gave it another try with a kind of dramatically different approach. And it had, it's been the flip side. It's been one of the best investments in marketing I've ever made. So I would say if you're not having good results with the method that you're doing, and you're afraid to pull the trigger there, try a different approach and see if one of these companies can get you a good deal. Because, if you're going to pay 20, 30, 40, 50% less for the mailers that you're sending out, let you send out more and see if you can get more success, that sort of thing.
Yeah, because you were doing the sniper effect before, and then you thought that was like, pff, now you just said just
Yeah.
throw it out there, and then now it's like really, really working, right?
Yeah. Yeah. The sniper approach got me, like we got some new patients from it, and the company I was using, they let us track the calls and listen to the calls and all these things. And that was really cool that all that stuff was available, but I didn't really have the time or the want to do all that, to listen to all that, and to track all those things. I'm just like, I want more patience, and so can you get me that or not?
Yeah.
Uh, and so for me, that's the shotgun approach was the way.
Awesome. Awesome, Talon. So I appreciate your time. And if anyone has further questions, you can definitely find them on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
Facebook is probably the best way. It's where I'm usually at. I don't have any other forms of social media, so
Awesome, man. All right. So Talon, thank you so much for being with me on this Monday morning marketing episode.
No problem. Thanks, Michael.